where you are resisting makes a big deal. If I want to check his hip flexion going forward, I don't mind if you do it. Just don't make me look too down on YouTube or whatever. Yeah, I Google myself on YouTube. There's all these videos of me. Okay, so anyway, hip flexion. Where do I resist? Below the knee or above the knee? And by the way, when you touch people, do say it's okay. Okay, if I touch you, my name's Daniel. I'll be your clinician today. I'm going to check your pain-free motion here, muscle strength, rhythm on a scale of 1 to 5. Let me know if you feel any pain or discomfort is okay if I touch you. Okay, just kind of get that in your mind when your spiel. Okay, so where am I going to resist for hip flexion? End of the femur. So go ahead, push against me, push, push, push. Okay, what did I just check? His iliopsoas, and one of the quads, which is his rectus femoris. Lisa's getting this, the transcription. Okay, so anyway, flexion makes sense, and when you touch people, just be nice. Okay, you'll get a lot more classes in this. Right now, it's learning the muscles of the nerves, and after that, you learn not to hurt people. By the way, when I graduated from college, you know what they told me? You're now a safe learner. So we're giving you a diploma because we think you're smart enough not to hurt anybody, and you can go on and learn more stuff without being dangerous. So anyway, that's the level of that. Okay, so then hip extension. It's hard when they're in the seated position. I'll be lift your leg up, push down on me, push, push, push. Okay? What would be the muscles? Hip extension. You look up here. Big old butt muscle is glutes, and then all three hands, right? BSS or what?
Biceps, femoris,
semi-membranous. Okay. Next we're on to hip abduction. Where do I resist for hip abduction? Do I resist on the femur or the tibia? I want to isolate the hip abductor muscles, which by the way are really important for balance. The gluteus maximus is really important for locomotion going forward. The gluteus medius and gluteus minimus are really important for balance. Very important for people. Okay, so where would I resist for hip abduction? You can stand up if you can. I know you can't see that. Stand up in the back. Okay, I'm going to resist here. Push against me. Push, push, push. Okay. What muscles? Gluteus medius and gluteus minimus, which are more standing posture muscles, not necessarily locomotion muscles. Okay. Then hip adduction, adduction, resist here. Push, push, push. Push against me. If an athlete pulls their groin, which I've done. What? Not that I was only good an athlete, but okay, what are the muscles of your groin? The adductor,
magnus,
adductor longus,
brevis.
Okay. Sound good? We got that so far? Okay, next is hip internal rotation and external rotation. And without looking up here where I gave you guys the cue, what would be the best way to check his strength? Internal rotation and external rotation of the hip joint. Again, it's the head of the femur in the acetabulum. How would I check that? Little clinical problem solving. You're going to have to stand up. Please do stand up. I'm going to check external rotation. Actually, I'm going to resist down here on the malleolus. You guys can crowd around here. I know it's hard to see. Back there by my work. What else? When you're resisting for the rotator cuff muscles, what do we do?
There,
Shoulder about 90 degrees, elbow about 90 degrees. Where would I resist for external rotation? Right here, for external rotation. Where would I resist for internal rotation? Here. So I had a 90-degree angle, right? Shoulder, 90-degree elbow. Okay, same thing here. See 90 degrees with the hip? With the knee. Okay, so if I'm going to resist external rotation, see how strong he is. Am I going to resist here or here?
Outside.
Hop up and try it. Have one person sit on the desk real quick. I want to prove it to you. Hop up there. One person a clinician, one person a patient.
Do you want me to like do 2 recordings or?
How strong he is.
Okay, we're just gonna.
And the opposite, obviously, if I'm going to check how strong he is, internal rotation of the femur in the acetabulum, I'm going to resist on his lateral malleolus, which is on what bone? Lateral malleolus? Fibula, lateral malleolus. What bone is the medial malleolus on?
Fibula. Okay, do you want to check it out?
I don't know.
I want to prove this to you, because people, when they do the manual muscle test, I
you
want you
guys
to do it quick.
Somebody sit up there. I want to see you
This
guys.
time, I want you to resist in the right place. So resist. Have I proved it to you? Okay, where do you resist to check strength of, mix it up, internal rotation of the hip? If hip is 90 degrees and knee is 90 degrees, if I'm going to check internal rotation, I'm going to resist lateral malar, which is on what bone? Lateral malar? Fibula.
Fibula.
Okay?
Okay.
If I'm going to check his external rotation, and it's going to be different in a supine patient. I'm going to check external rotation. Where am I going to resist?
No, you're good. It's not even mine.
Medial side of the medial malleolus, which is located on the. You got it? Now move on. Okay, next would be then the knee joint. Oh, you know what? Okay, the muscles are up there.
Oh, okay.
I'll zip through them. Okay, I gotta be perfectly honest. I don't have everyone memorized off the top of my head. I haven't done this since last year, so. Okay, anyway, moving on down to the knee joint. If I'm gonna check knee extension, where do I resist? Here, here, or here? Okay, but just slightly above the ankle at the distal tibia fibula. Okay, so I'm gonna resist here, push against me, push, 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 like you're kicking a soccer ball. What's the action at the knee?
Extension.
What muscles? RVV. Craigie's down here, obviously.
Rectus femoris. Vastus.
Vastus, vastus medialis, vastus intermedius, and we'll show you this on a cadaver. You can feel the vastus lateralis. That's a common injection site for kids. The vastus intermedius, you have to cut through the lateralis and medialis. You can see if you do that in the lab. Okay, how am I going to resist his hamstring strength? Actually, which is what? Knee
Flexion.
flexion. How would I resist? Am I going to resist here, here, or down here?
Down.
Down by the Achilles. Distal, tib pit. What push against me? Push, push, push. And obviously Alan's a 5 out of 5 on everything here. Congratulations. Okay, so everybody see where I'm resisting here? Not directly below the knee. You want to give yourself a lever arm, which is there. What muscles?
We don't know because it needs to be scrolled down.
But I did tell you, right? BSS is what?
Biceps femoris.
BSS. Biceps femoris, the two semis.
Semi.
Tendinosus, semimembranosus. Do all three hams cross the knee in the back? Yes. Do all three hams cross the hip in the back? What do they do for that? Hip. People mess up on this in the test, so that's why I want to be sure you got it. Hip. Extension. And what do they do at the knee? Hamstrings.
Flexion.
Knee flexion, which is going back. And there's one other muscle where the muscle belly is distal to the knee joint, but it still crosses the knee, and that is what? Inserts with the Achilles tendon, the gastroc. The gastrocnemius does cross the knee in the back, so you have an additional knee flexor. Okay, and the major knee flexors are obviously the hamstrings, BSS, but if you hurt the hamstrings, you got a sciatic nerve injury, Charlie horse, pulled tendon, or something like that, people can still walk sometimes. It's really pretty amazing how they can adapt because they have a synergistic muscle that assists the hamstrings. Okay, and that is the gastrocnemius. Does the soleus assist, good test question, does the soleus assist in knee joint flexion? Soleus. No, because the soleus does not cross the knee. It originates on the below the knee. Okay, what are your two plantar flexors? I don't went over this. Gastrocnemius and soleus. Both of them insert where? What bone? Not the talus, but the calcaneus. The Achilles tendon. So they both plantar flex, right? Gastroc and the soleus, but only one flexes the knee, which is what? Gastroc. Okay? So where are we resisting then for knee extension? Right here. Knee flexion right here. And then the ankle joint, which is you cup the calcaneus with one hand. I'm going to check. What's that? I don't know, do I? Sure. Okay. It's a good question. Okay, so anyway, I'm cupping the calcaneus here. If I'm going to check dorsiflexion, where do I resist? Here or here? Dorsiflexion is up. Plantar flexion is down. So I'm going to resist.
On top. On top.
Push against me. I know you can't see back there. You can move around. Okay. Push, push, push. Push against me. Muscle is the TA. Tibialis anterior. What's the TA's claim to fame? If somebody has a stroke, I'm checking Alan's left leg. If he were to have a stroke on the right-hand side, he would often lose the TA on the left, which is why people wear the support ankle supports. If you can't dorsiflect during the Dorsiflexion, what muscle?
Two.
And you can memorize the nerves if you want to. Plantar flexion, go ahead and go at 90 degrees. Plantar flexion, push against me, push, push, push. Muscles. There's nothing. Gastrocnemius and soleus, calf muscles. Okay, inversion, I'm going to resist here, push against me, push, push, push. Inversion is not the TA, but it's the T key, tibialis posterior. Okay, and then eversion, if you're down here, you can switch over, have the other hand, cup to cup, meaning resist here, push against me, push, push, push. Three muscles are the main muscles, those are the prime mover muscles, and they're on the lateral leg. What bone is in the lateral lower leg? Fibula, so the fibularis, longus, brevis, and tertius, exactly the same as the, what? Nope. Perineal muscles. Perineus, longus, brevis, tertius, exactly the same muscle. In older versions of Gray's Anatomy and stuff, it'll say the perineal muscles. Fibularis makes more sense to me. Okay, and then the toes are here. Toe flexion is down, like that curling your toes. Toe extension is up. Have I given you enough to think about it until over the weekend? Okay, we'll review this on Monday. This is your, most of you guys really aced your manual muscle tests. Good job. And by the way, there's a big difference between nervousness and lack of preparation. If you're nervous when you're performing the test, I'm not a bit worried about it. I really not. You'll be great. Okay, but if you don't prepare when you come in, I made some huge mistakes when I was in school. I had to redo some practical exams because I just walked in and winged it, just to be honest with you, which I regretted doing. So, you know, practice it through a bunch of times. Time yourself. You should be able to zip through it pretty quick. Okay? If I get time at the end of class, I'll do another brief review. How's that? But I do have other stuff. If I get behind, I really get behind. So, thank you, Alan. Appreciate it.